kicking off, I just wanted to say the meeting has been held in accordance with the provisions of the local authorities and police and crime panels. It's probably the fourth or fifth virtual meeting of the Health and Wellbeing Board we've had in the last 12 or 13 months or so. And before going to agenda item 1, could we just do a roll call so everyone knows who's on the call this morning? What's your name and where you come from, perhaps? Shall we start with you, Councillor Grottick?
Thank you very much. Frank Grottick, Vice Chair of the Council of the Isles of Scilly.
Robert Francis, Chairman of the Council of the Isles of Scilly.
Paul Charnock, Health Watch, Isles of Scilly.
Catherine Fuller and Karen Hodgen from Health Watch, Isles of Scilly.
Don't be shy.
Oh, okay. Ashlyn Khan, Director of Adult Social Services and Children's Services.
Jonathan Smith, Lead Member for Environment, Council of the Isles of Scilly.
Morning, I'm Jo Arundel. I'm the LPA Commander for West Cornwall and the Isles of Scilly, Devon and Cornwall Police. Good morning.
Good morning.
Morning, it's Rachel Wigglesworth, Director of Public Health, Cornwall and the Isles of Scilly. Morning, everyone.
Morning, Adam Painter, Deputy Leader, Cornwall Council and Chair of Cornwall's Health and Wellbeing Board, just listening in today.
Is anyone else on the call who hasn't said who they are? Okay, could I just also welcome everyone, obviously, but also mention that Councillor Dan Marcus, who's Vice Chair of the Health and Wellbeing Board, one of his other roles is IT manager at the school, and he's got to get lots of things ready for Monday's return, so he's regrettably passed on his apologies. Alison, I've just seen your face pop up. Did you just wish to introduce yourself?
Hi, apologies for being late. I'm Ali Butterell. I'm one of the partners at Helston Medical Centre and obviously involved with the St Mary's Health Centre.
Good morning all. Agenda item 1 is declarations of interest. Has anyone got anything they would like to draw attention to? Councillor Smith?
Yeah, thank you, Chair. Just a non-pecuniary interest, agenda item 6, because my wife is a mental health practitioner.
Thank you very much. Councillor Grottick?
Thank you, Chair. Just to record, please, that I represent the Council on the Cornwall Partnership Trust and that I have a family member involved with the Haven project. Thank you.
Morning, Abby.
Hello.
Did you just wish to introduce yourself to other partners?
Hello, I'm Abby Wrigley. I am working on the testing process here for the council.
Thanks very much. Agenda item 2 is minutes of the meeting we held in September. Has anyone got any comments or queries about those, please? Councillor Grottick.
Thank you, Chair. Just a quick amendment, please, Andy, on page 2. I think you just need to clarify that the monitoring of isolation aspect, clarify that it's the lack of participation in appropriate isolation that is a matter of legal. It is a legal issue that will be addressed. It is not terribly clear. Thanks.
With that amendment, are we happy to accept those as a true and accurate record of the meeting? Ashley, your hands up.
Yeah, just a really minor one, but luckily for my partner, I'm a Ms., not a Mrs.
Thank you. I will amend. Thank you for that.
Are we happy to find a proposer and seconder for those amendments to be recorded, please? Councillor Francis and Councillor Grottick, thanks very much. I don't have any urgent items, which is agenda item 3. So I think that takes us into agenda item 4, which I think Ashley is going to give a verbal update on.
It's not me, it's Helen Charlesworth May. who I can't see on the call. So I'm happy to go to my agenda item and see if she comes, and I can drop an email to her, or if anyone's got her mobile number.
Okay, should we move on? If you're happy to go on to agenda item 5, which is Better Care Fund, that's fine for us.
Thank you, Chairman. So Better Care Fund, those of you who've worked with me on this over the last 3 or 4 years will be aware of how much we've improved our governance arrangements. And so this paper represents ensuring that you have oversight of how this fund is spent. As you know, it's money that flows through from the government to CCGs and then to local authorities to fund shared priority schemes to benefit communities and keep people living as independently at home for as long as possible. So this paper gives you the Q3 position and the likely forecast for year end. Obviously, there'll have to be some tidying up after year end has passed, but I just wanted you to know where we are. And despite some of the challenges of this last year, we've actually done quite well in getting schemes away. There's obviously been an impact on the delivery of access to services because lots of people haven't been going anywhere. But generally speaking, really strong. I think the pilot project on healthy ageing has definitely suffered from not being able to land that properly, but I don't want to give up on it. So you'll see that for proposals for next year, it's actually how do we rethink that, what resource can we put in, because there's definitely something, as we all know, around supporting a really healthy ageing process through participation in physical and, emotional well-being. So there's your Q2 position. My proposal is that any underspent is rolled forward. It should, at the moment, it's looking at about 9K. There might be a bit more once we get clarification on how much equipment we actually hired and so on. And that goes forward to next year to fund schemes, which we can agree once we know the final amount. Based on next year's indicative allocations, and I need to say indicative a lot, I'm proposing this is how we spend against schemes. They are all recurrent. There are no new projects. It then needs to go, if you're happy with the general direction of travel, then it all needs to go through the shared governance. And I know that before this call started, there was conversations about how health and wellbeing boards in Cornwall and Scilly might work together. And I think some of that is reflected that we actually have some underpinning governance that's joint. So therefore, it makes it even more logical that it comes to kind of a shared place when we're looking at the Better Care Fund. So there's our proposals. I want you to ask questions, please. Let me know how you perceive projects. I would particularly like to highlight how happy I have been that we've finally, after many years, managed to get the beginnings of an organised volunteer service for the island. The way that Scilly Support Services responded to the challenges of supporting nose shielding over the last few months has been extraordinary. And I think we've laid a really good foundation for a befriending scheme for doing those small tasks that help people remain independent and to minimise their need for statutory services. So that's I feel, a real achievement for us. Okay, I'll stop talking.
Thanks very much. I think it's a really good, positive report. I know everybody is working absolutely flat out at the moment and going above and beyond for so many different reasons. But I'd really like at some point if we could have some sort of metric on how many beneficiaries and the outcomes the investment we're making is achieving, because at the moment we've sort of just got a summary and a spreadsheet of numbers, but I suspect that underneath that is some real life-changing work going on. So when things calm down, perhaps that could be something. I just wanted to ask a question on mental health services, and I don't know if we know the answer, but in the report it talks about an increase from 40 to 65 per month, and I was wondering whether that was due to COVID and all the things going on, or whether it was due to just more confidence in the service and people having the trust to come forward and talk about those sorts of issues. I don't know if we know the answer to that at the moment.
Chairman, I'm happy to respond. Firstly, on the detail, what we usually do is bring an annual report. Once we've done year-end and reconciled all the figures, it then gets embedded in an annual report, which should come to a meeting usually around July. So that will give you all that detail, because you're absolutely right, that's what we usually do. We get these much more kind of figures and KPI reporting. And then on the mental health stuff, definitely there is stuff around COVID, but we're also seeing real confidence in the service. And I know one of the source of the pride, and we'll put that in the annual report, is that we're seeing more males coming forward. So that's a really good service. I think also it's working exactly how we wanted it to, which is that if you can provide things on island, you can prevent emergency admissions. So we've had no fly-offs during the winter, and so that's exactly the model we wanted, where you have really strong primary care provision. That means that people are supported at the earliest possible stage, so that we don't have crises coming out of nowhere, that we, people in trouble that we weren't aware of. It's a really strong service, and I know that Helston have really, really liked having that pathway to refer people to. I can see Alison nodding away.
Thank you. I certainly think the improvements in service have been something we should all be proud of over the last 3 or 4 years. It's come on leaps and bounds. A few people have got their hands up. Councillor Grottick, did you have a query?
Thank you, Chair. Yes, I totally support the mental health support that we've got on Ireland. It's a pivotal part of, really, when you think about it, of our integration programme, which is as much health as we can, as much health and wellbeing services as we can manage deliver close to home. And the prevention agenda is so important. And following on for that, wouldn't it be lovely to think of a lasting positive aspect of COVID, which I believe Healthwatch have helped us to achieve, which is that I really do believe we know more about our vulnerable people on the islands now than we ever did before. And Councillor Watt picked up at a recent scrutiny meeting that, as colleagues will know, we have a high proportion of single households, and while not all of them are lonely and many of them are really happy, nevertheless there is a small but significant number of islanders who are really lonely. And it's been estimated in a recent report that being lonely is actually as bad for your health as smoking 15 cigarettes a day, which really brings it home just how devastating it can be. And I'm just thinking that as we look at our corporate estate and our integrated hub, wouldn't it be wonderful if we could have some sort of community centre where if you live on your own, you can go and get a cup of coffee, sit and read a newspaper and exchange the time of day with some friends. I think that would be a really positive move forward. Thank you, Chair.
Thank you. Paul Charnock, Chair of Health and Wellbeing Board. Healthwatch.
Thank you, Chair. Just for your information, thank you to the previous two previous contributors and their kind words about Healthwatch. I would like to support that by saying that the work of Karen and Catherine, our staff, that they put the amount of work they put into developing the volunteer service as it is at the present moment. Is well recognised, and I commend them for the work that they've done. Just for your information, we are sending a nice card to our volunteers, thanking them for their input, which is for a period of nearly over 12 months now. We've actually had up to 44 volunteers either contributing a little or contributing a lot, which I think is quite a compliment to the community of Scilly. 44 in the big world doesn't sound a great deal, but on our island, and we think we can do a little better. I think that's commendable. The number of residents who've accessed support for shopping items such as shopping, befriending, or giving more formal support. We've had there are 37, and for the 37 residents, for people who've been receiving a sort of a lower input service, be just going to Mumford's for the newspaper to collect their newspaper. They've been matched up with volunteers, good neighbours who now help them out. There's a total of 53. So I'd like to formally thank those volunteers who've contributed to the service. The service is developing further in that it's going to be we're going to try run it at two levels. One is the very simple level, but the more formal level will be where we hope to contribute even more to the community. But that will require, we have the policies in place, which will include DBS checks. And we hope to, we've just started to talk about that, the launch of that service. we hope to do that in the very near future with support from the Better Care Fund. I don't think I have anything further to add other than we are going to buy the volunteers. We can't have a meeting with volunteers and tea and cake or coffee and cake or whatever. So we are going to arrange for any of our volunteers who wish to have one of Becky's cakes delivered to them, hopefully. Obviously, other outlets are on the island for obtaining cakes, but we just thought it would be. It's just a token. Okay. Any questions, and we'll either myself or Catherine Fuller will be pleased to answer them.
Thank you, Paul. 100% echo the thanks to volunteers, whether they're doing it via Healthwatch or doing it more informally. I think they've shone and helped Silly to cope with what's been a very difficult period of time. So again, I would totally echo that. Thanks. Ali, your hand is up.
It was just going back to the loneliness part. Is one of the social prescribing link workers at Helston set up, and obviously it's not running at the moment because of COVID, but they set up almost, it sort of replicated itself. So she organised just a time at a coffee shop where people could just pop in if they were lonely, and there'd be someone sat there and they could just sit and have coffee and a chat. And then what actually happened was that volunteer then passed it on to another volunteer, and it sort of kept that ball rolling, so it could be different people. It's not something that worked now obviously, but it's worked really well in Helston. And if anyone wanted any information on that, she'd be delighted to pass that on. So if they get in contact with me, I could pass on her details so that she could talk about how she set that up.
Thanks very much. Councillor Smith.
Yeah, thank you, Chairman. Absolutely echo the work of Healthwatch and all the volunteers. Very, very good. So thank you, everyone there, and Healthwatch for performing such a vital role over the last year or so. One question touching on the mental health issue. It's obviously very good to hear that we've got more resource there. Obviously, in terms of people's mental health, there's varying degrees of that, and I'm just wondering how much we're able to reach those who are on the kind of lower level of poor mental health, or is it generally around more serious cases? I mean, maybe this is something for the paper that's coming, as Ashton said, more sort of towards July, but I'm quite interested in that kind of split of what cases we're reaching out to. Can anyone comment on that at the moment?
Tim Francis here, Councillor Smith. Apologies, I've got an agenda item later. I can comment. I'd like to pick that up later if I can. But this is about inclusion. It's about early intervention and prevention. So there are the means to engage earlier, particularly in harder to reach groups, younger adults, those that are lonely, older people who might feel isolated. And I can capture that later, hopefully, in a more comprehensive summary.
Excellent. Thank you very much.
Thanks.
Thank you. Chair, if I can just do a second part of the question.
Please do.
Yeah, probably more towards Ashley in this one. So in the last Health and Wellbeing Board, we asked about possible funding for boating, for medical travel to and from our islands, particularly during the winter period. So first question is sort of whether there's been any progress on that idea, and particularly with the potential underspend in the Best Care Fund, whether that's a possibility. And it's kind of related to that, just looking forward to the budget for next year. Is there any potential problems given of things going over budget given potential inflation for the next financial year?
Thank you, Councillor Smith. I don't foresee an issue with inflation. I've discussed all of this with the scheme provider, so that's okay. I think the offer, you're absolutely right, the offer to support families with boating costs was made. So we identified those families and made them, and through the practice, that anybody who did need to come to St Mary's for appointments would have their funding paid for. So that provision was made. But actually, what I will say is that St Mary's Health Centre have been really strong on continuing to provide on-island support and providing those surgeries when that was possible. So as far as we're aware, there's been no barriers to accessing primary care services. Health Visitor reports really good uptake of IMS and, postnatal appointments, etc. So that's been strong. And as you know, we've got an entire partnership working on all sorts of hardship for people over the last year. So we've been able to identify very quickly those who might need additional support, not just with transport.
Okay. Thanks, Ashley. Thanks, Chairman.
Thank you. The final question from me was about long-term sustainability of funding. There's a line down towards the bottom of the report that talks about funding not being guaranteed. Is that something that weighs on your mind, or are you?
Yes. Yes, I think, and my colleague Helen will pick up on some of this. I think one of the things about the Better Care Fund is that it gets announced quite late. We're still it's March, and we've got indicative funding for schemes starting in April, and that's been the case forever. So there's a certain amount of risk that's placed on commissioning bodies. So one of the ideas in the white paper, which Helen might discuss in more detail, is that the BCF goes on a statutory footing, so that you have kind of more sureness about what it is you're going to have in the pot with greater notice. Helen, do you think that's true?
Yeah, so for those of you who don't know me, I'm Helen Charlesworth-May. I'm the Accountable Officer of Cornwall and the Isles of Scilly CCG. So we will talk a bit about this under the white paper, but what the white paper is suggesting is that the Better Care Fund goes onto a statutory footing, and by putting it on a statutory footing, there will be expectations around funding that goes, sources of funding into the Better Care Fund, and the ways in which that is being spent. And it is our expectation that it will potentially mandate the contributions into that fund. Ashling's absolutely right, and this year has been a particularly difficult year, is that the guidance in respect to the Better Care Fund never comes out at the beginning of the financial year. It is always significantly delayed, and this year it was, I think we were in the final end of last quarter before we even had a real indication of what was going to be expected of us. That makes us as commissioning organisations, it makes it very difficult for us to comply with the requirements of the Better Care Fund, and it makes it very difficult for us to understand what levels of risk we might or might not be carrying. I think at the moment there is still work to be done around clarifying the absolute intentions of the white paper that's come out and what will be in the bill. I think what we need to do over the next month or so is be really clear about what we would like out of the bill, particularly in relation to the Better Care Fund, to make sure that we don't end up in this sort of perpetual cycle of uncertainty, managing risk, and delays in clarification agreements.
Thank you. Thank you very much for that. Councillor Grossick, your hand is up.
Thank you, Chair. If I could just add that I totally support that we've used part of the Better Care Fund to support recruitment and retention of our adult social care workforce, which is obviously a really pivotal part of what we do. And if there's anything that this committee can do to support the statutory definition of the Better Care Fund, I'm sure the Chair and colleagues would be very happy to do that, because it would allow so much better planning if we knew for sure what we were actually going to receive. I know that's stating the obvious, but there we are.
Absolutely. Thank you very much for that. Any final comments on the Better Care Fund? We've got two recommendations which we can take together. Are we happy to take those? Do I have a proposer and seconder for those, please? Councillor Smith?
Yeah, I'll propose.
Thank you very much. And Councillor Francis, I can see your hand up. Thank you very much. That's much appreciated. Helen, we skipped to item. I'm not sure what the item was, but we missed your integrated care system item out. So perhaps if you could take that one now, please, would be appropriate.
Yes, and I'm really sorry I was late. There was a thing I just couldn't walk away from. I'm very, very sorry. So thank you for inviting me. And the first thing I would say is this should be the beginning of a conversation and a start of us working together to shape how we want to interpret and respond to both the white paper and the bill when it comes out, but not just responding to the proposed legislation, but actually working through how we want to implement the legislation collectively. And the reason I say that is because the very clear messages that we are receiving from the Department of Health and Social Care and from NHS regional colleagues is that the legislation will be broad brush and permissive, and it is intended to provide a framework in which we operate rather than a template prescribing how we operate. And I think that is, I think that's important for us to recognise and acknowledge. And for a couple of reasons. The first is that I think we should grab that opportunity, because if we don't grab that opportunity, both in responding to the white paper and the potential legislation, there is a real risk that the legislation that comes forward will reflect the needs of places like London and Greater Manchester rather than places like Cornwall and the Isles of Scilly. But also, as a place, we have made huge strides in developing an integrated care system. As you know, we were designated as an integrated care system under the rules that are currently in place. We were designated at the end of last calendar year, and we don't want to lose the benefits and the gains that we've made as part of that designation. What we want to do is we want to use this as a vehicle for implementing what was always our vision and plan, rather than pausing and waiting to see what legislation says and what we should do next. What I plan to do, if that's okay with you, is just run through some key headlines and then have an opportunity for a conversation. So the Department of Health and Social Security issued its legislative proposals in February, 11th February. It issued those legislative proposals on the back of an initial consultation that was issued in December, and to which we, as a CCG, an integrated care system, and a series of provider partners responded. And that response was largely supportive of the proposals, but the CCG's response expanded on that to talk about what consideration we wanted to be given to the staff who work in CCGs in particular, because they were the ones most directly affected by the proposals that were likely to come forward. The paper breaks down into four broad themes: working together to integrate care, reducing bureaucracy, improving accountability and enhancing public confidence, and then addressing a series of additional measures which focus on public health and addressing health inequalities in particular, and looking at opportunities to maximise improvements in the way in which we deliver services and the outcomes we might expect from services by addressing some of the barriers that we know exist. So those things around reducing bureaucracy, etc., and the way in which they impact on our ability to do some of the work we're trying to do. So in terms of integration, it comes at this through two routes. It looks at integrating NHS organisations. So it recognises the fragmentation that arose from the legislation in 2012 and is seeking to address some of that by taking down some of the barriers to collaboration, deprioritising that focus on competition in order to prioritise collaboration and partnership. So that is within the NHS. But it also seeks to strengthen the opportunities for integration between the NHS and local authorities in particular, but it isn't just about the NHS and local authorities. And in addressing that challenge around integration, it is essentially suggesting a structural response. That structural response will be an NHS board that is responsible for implementing and overseeing the NHS-specific accountabilities. And we need to be really clear about this, that means taking receipt of the funding that comes from the Department of Health and Social Care into the NHS and down through NHS structures, so taking receipt for that funding and making sure that that funding is allocated in a way that will deliver the shared outcomes that are set out by health and local authority and other partners to deliver the health and wellbeing strategy, and overseeing and monitoring performance in those NHS organisations in order to demonstrate the delivery of priorities. So there is that sort of quite key structural piece. And I think the thing it is worth saying is that there is a reading of the white paper that could lead you to think that structural change is really about the CCG morphing into and becoming the ICS. I think that would be a very, very limited reading of the white paper. And certainly the conversations that are taking place are clearly setting out expectations of much more significant change than that. And that will, as a starter, include the delegation and devolution of some of the budgets and powers that are currently held at a regional level to an ICS level. So there is that key first bit of structural change, which is about an NHS body. And then there is a second structural bit of change, which is about the creation of the Health and Care Partnership Board. And that board could be broadly interpreted as reflecting or equivalent to the ICS arrangements that we as a place have put in place through the Cornwall and Ars Scilly Integrated Care Partnership that we are all members of. And there is a lot of debate. Those are the two areas around which there is most debate at the moment. So moving on from those issues, there is then the whole issue of reducing bureaucracy. And this absolutely goes to the heart of some of the changes that will address some of the 2012 arrangements that were put in place. So this is absolutely the bit about moving from competition to collaboration and creating the legal mechanisms for NHS organisations to work together. Because, as an example, CCG and our provider organisations cannot enter into legal partnership arrangements, which makes it very difficult to do some of the things that we might choose to do through an integrated care relationship. So the reducing bureaucracy is absolutely about tackling those sorts of things and providing more support to the workforce. That whole bit about how do we grow an integrated health and care workforce is a core element of this. And then improving accountability and enhancing public confidence. Now, interestingly, there isn't a mandate in there. There isn't at the moment a proposed legislative mandate around the involvement of people who use services. Now, I know that there's quite a lot of discussion going on around that nationally, and whether that is right or wrong. I think we've been really clear that as an integrated care partnership, we would want people who use services to be absolutely embedded in the governance and decision-making arrangements of that integration. And we are starting to see some of those conversations through Healthwatch and some of the systems advisory arrangements that we are putting in place. And the conversation you just had about, how the engagement with people who live on the Isles of Scilly and how they become more actively involved is absolutely critical to that. And then that broader piece about additional measures, absolutely addressing health inequalities. There are some very specific things in there about discharge to assess models, how we might make direct payments to providers, how there will be greater oversight of social care providers through the implementation of this legislation. And then finally, and this is a conversation that is actively happening at the moment, in which there has been some confirmation of this morning, so a meeting I was at earlier today, is that the Department of Health and Social Care is actively saying now that the footprint of an ICS will be a footprint and place that is reflective of local authorities. Now, that is not the case at the moment in terms of the what were the STPs. I can't even remember what STP stands for now, but that some of you will remember STPs from about 4 years ago. The footprint for those were not aligned to local authorities, and as a result of that, the footprints of some of the integrated care systems are not aligned to local authorities. The Department of Health and Social Care is now saying that that is what it would like to see, and therefore some of the integrated care systems in other parts of the country will be affected by that. But I'm pleased to say that in Cornwall and the Isles of Scilly, there is recognition that our geographical footprint will be the geographical footprint of our ICS, and so for us, no change from what we agreed as a partnership back at the back end of last year. And then, so sort of reflecting on the fact that the white paper is setting out a permissive, non-prescriptive description of how it wishes to see ICSs implemented. The next stage for us is for us to start to work through what do we want our ICS to look like, and how do we wish it to operate, and how do we want to take the greatest advantage from the permissions that will be in that white paper and hopefully in the bill in order to drive improvements in outcomes for our populations. And really what that means, I think, in fairly straightforward speak, is what is it we want to link up more closely? How do we want to structure our health and care teams so that they are absolutely as close as is possible to our populations? And how do we want to join up the service offers that we're putting in place so that people only really need to go to one place in order to get the totality of their health and care needs met? Now, on one level, the islands is absolutely at the forefront of this agenda, because there's much that you've already done that is absolutely in that place, and what we need to ensure is that that is protected and not undermined, and that actually the rest of Cornwall gets an opportunity to learn from what you've already done in the island. So I'm going to stop there. I'm sorry, that was quite a long description, but I'm going to stop there and happy to take questions.
Thank you for distilling what must be an incredibly complex cultural, organisational redesign into something that I can understand most of. And I'm also very pleased with the comments around footprints as well. It obviously makes life easier when we know where the boundaries are and that they tie neatly together. Councillor Grossett, your hand is up.
Thank you, Chair. Firstly, I'd like to say it's incredibly reassuring that the key question is what do we want our ICS to look like? And obviously I would argue, and I would imagine colleagues would agree, that you cannot answer that question without including the views of the users of the service. That must be part of the engagement, obviously. And secondly, I don't want to seem negative, but it's obvious to me that the devil is obviously going to be in the detail. I think that Helen Charlesworth-May, you were absolutely correct in flagging for us that issues around governance will be, again, a key part of the discussion. If I could just quickly mention one quick concern of mine, it's that at the moment this authority has a great deal of autonomy around its budget with regard to adult social care. We have decided as a council that we wish to protect adult social care, residential adult social care on Ireland, and having that autonomy has been pivotal to the retention and improvement of our services over recent years. I would not like to see that in any way diminished by the funding going to the NHS and then be passported through to the islands. I'm not suggesting any disappointment with that system beyond saying that we must have the autonomy to know what our funding is going to be long term in order to plan. And if we are waiting on NHS budgets to then passport parts of our budget, I can see that it might be a bit of a lumpy progress. Thank you.
So picking up that point first, I don't think there is any suggestion at all that local authority funding for social care will go into the NHS and from the NHS back to local authorities. There is no suggestion at all that is what's in there. What is in there is a desire to see budgets more closely aligned to more alignment between adult social care and the NHS in terms of the way in which they spend that money. I think the bit I would say, I'm here today as the accountable officer of the CCG, but I am equally the Director of Adult Services in Cornwall Council. And I suppose my reflection is that the NHS is very unlikely to want to take on responsibility for funding for adult social care. And the point I constantly make with my NHS colleagues is that in reality, most people who receive services for adult social care and are funded through adult social care are funded totally independently of the NHS. Those people where they are coming through hospital or are being jointly funded by the NHS and social care is probably only about 10% of the people I see and support. So the bulk of the funding remains adult social care, local authority funded, and that I'm sure will absolutely continue. The bit for me is how do we make sure that we develop services that enable people to remain independent rather than becoming dependent on health and care services. And what we know from the evidence is that people who go into hospital and come out of hospital tend to have greater service needs than those who are supported initially within the community.
Thank you. I was asking partly to get that reassurance, which is very good to hear. Thank you. And I would just say with budgets that alignment is fine and merging would obviously cause the problem. So many thanks for that reassurance.
Thank you. If I could just ask a question. I really don't want it to sound patronising, but it might sound patronising, so apologies if it does. But I could imagine there are hours and hours and hours of meetings and conversations and discussions going on. And I just wonder how, with our small capacity of staff over here, our officers over here, how we're placed to engage in all those discussions to make sure our voice has been heard and our needs being listened to.
So there aren't hours and hours of meetings yet, but you're right, there are going to be hours and hours of meetings. There always are. So actually, one of the questions is, how would you like to be involved? Because what we have identified is that we absolutely need to have non-exec directors and councillors. We need them to be describing to us in the first instance their aspirations for the population. And then we as a group of officers need to go away and work out how we can meet that need. Now, we are having some individual conversations. So I'm here today talking to you. There is a conversation going to be had with Cornwall councillors, and there have been some conversations with CCG governing body and the non-exec directors in the two trusts. The next step will be, how do we bring you all together so that we have a shared position? And what we'll try and do is we will try and do that. I think we will need to do that over a set of meetings. I don't think that can be a one-off, but we will try and do that in a way that that is not overly onerous, but does make it possible for everybody to contribute. I think we're likely to have 3 or 4. I think we need about 3 or 4 probably evening meetings where we can engage with a broader group of people as possible. And then Aisling and I will need to work through how is it we are going to make sure that the Isles of Scilly voice is absolutely reflected in any design and decision. And of course there can't be a decision without you, but any design certainly. And what is it that is specific and different and special about the Isles in comparison to the mainland? And what do we need to capture in that regard? So that, I mean, the reality is that's not been designed, and part of this conversation is how do you want that to work out?
Thank you. Aisling, your hand is up.
Yes, I'm just going to reiterate the point that Helen made. So we'll put some time in with the relevant people to discuss what it is, what our ask is, because we can't go to everything, and that wouldn't be sensible. But obviously don't forget that lots of our CCG colleagues are ours as well. So at some of those meetings, would they represent us in the interest of the islands? And what are the key kind of fora where elected members and officers can be saying the right things at the right table? But we can't go to every table, and that's understood. So just want to reassure you, Chairman, that we have got a plan to see how we can engage over the next 2 years.
I am reassured. Thank you very much. Any other questions for Helen at this stage, please? We don't have... Oh, your hand's back up, Aisling.
Sorry, again, it is just to underline the points that Helen was making, and I think her big... what you must have heard her say, let's learn from Scilly. And that's what I feel very reassured about, is that everything we're doing on Scilly is absolutely in line with not only current government guidance, but emerging guidance. It's exactly how it's meant to look. So I have always found it really helpful that Helen sees that, and we've always been given respect for that. So meetings to this point have always, it's a bit like with the Better Care Fund, it's understood that we have a different commissioning way of doing things, but it's actually quite good because it's making a difference, and it's creating the kind of the fora for, independent living, preventing people from being dependent on statutory services. So I just wanted to highlight that point, that yes, all this new legislation is burdensome, but it probably won't really change everything we're already doing. It'll probably really help us.
Yeah, I would reinforce that point. I think it absolutely reflects what you're already doing.
Thank you. Councillor Crawford?
Just to say that colleagues very much enjoyed meeting Helen Chatsworth-May when she took up her appointment, and hopefully as things progress we can welcome her back again to Scilly post-COVID to explain with Aisling what is progressing.
Oh, I would love to. I'm really looking forward to that. Thank you very much.
Thank you. Well, we certainly look forward to what pans out over the next few months and years We don't have a formal recommendation, but perhaps we can just note the contents, and we'll keep a watching brief and do whatever's asked of us, I think.
Yeah, and if I can just say, so the timetable is what I would describe as quite an aggressive parliamentary timetable. So the government is saying that the legislation will be enacted in May, assuming that they can get a majority to get it through the Houses of Parliament. And should that timetable be met, there is an expectation that the legislation will be enacted from the 1st of April 2022. So it is a very, very fast piece of legislation. And the bulk of the work that will be expected to take place from September onwards will be the technical work about setting up the ICS as an entity. So all that HR and legal process that has to go on around creating an entity and the transfer of responsibilities from one legal entity to another legal entity. So that will be a very, very significant bureaucratic exercise. What is really important is that we don't lose traction on the service improvements that we're trying to make at the same time as we're trying to effectively implement what is an administrative change.
Thanks very much indeed. Sounds like you've got a busy year ahead.
Yes, probably.
Thank you. I think that concludes agenda item 4. So if we could now move on to agenda item 6, which I think, Tim, is your report.
Yes, thank you, Chair. I'm just pulling up a document here. So Tim Fries is Head of Joint Strategic Commissioning for Adult Mental Health and Learning Disability and Autism. You should have a summary paper, councillors and committee members, describing the next steps to develop the implementation plan and an additional outcomes framework to support the delivery of the adult mental health strategy, which you can see behind me, Futures in Mind, which was ratified, signed off, and has now been published as of the back end of the summer of last year. So really, I'd like to better give you an update on the position. I'd like to assure members that, as was pointed out by Helen Charles of May, the imperative is to maintain traction on the delivery of much-needed transformation to improve the outcomes of people living across our communities, both on and off island. We haven't relented in our commitment to that. The publication of the mental health strategy clearly fell within the first phase of the second lockdown, but the team have worked across all sectors, across local authority and health, with a range of partners and stakeholders, including the views and voices of people with lived experience, with the support of Health Watch, to keep things on track. And at the bottom of the document, you will see the next steps. So I'll take you through the document itself. So to remind ourselves, the mental health strategy is trying to achieve two things. It's trying to provide assurance to statutory bodies and also the population that we're delivering the must-dos, the key deliverables set out in the NHS long-term plan, but also to respond to the local and very bespoke needs of our communities born out of the Joint Strategic Needs Assessment and the work that we've been doing with Rachel and her team to understand the emerging needs of the population. The key priority areas in this strategy are an emphasis on prevention, improving access to the care and support, also to ensure that we move towards a more personalised care offer with greater choice, that we maintain our focus on recovery and resilience, supporting people to remain well and supporting people to remain resilient and access earlier support. Also, greater integration is the means to be delivering this within place-based models, as was described briefly earlier, and with the means of new technology, hopefully seeing more accessible support, more support delivered online, as we've seen through the COVID pandemic thus far. We have enhanced and broadened the offer online, as many of you will be aware of, and I've presented on some of that before, and I'm happy to touch on that later. But also, more importantly, the ability to measure the success maybe the good, the bad, and the ugly sometimes of what we're trying to do. Hopefully, not the ugly, but certainly get that return on investment right for the people that live in our communities, to assure ourselves and our regulators that we are delivering the very best that we can within the resource envelope available to us. So we have, since the development of the strategy, established a system-wide mental health strategic board that provides the governance and vehicle for oversight and steering the outcomes, but also, most importantly, the deliverables. The partnership that has gathered within that space is a strong one, and we've benefited from that in terms of its cohesion, collaboration, and commitment to the cause. We have also developed and are in the final stages of a task and finish group looking at developing the implementation plan itself. That hasn't been an easy task across the system of care and support, across adult social care and health, and those areas in public health, which include prevention. There are a number of different things that have been going on and which we need to represent and bring together, not least to ensure that we are trying to do things once, not twice, but also being as efficient as we can to work together. For example, some of the means of prevention, primary prevention, are things that we want to be doing in collaboration and are doing in collaboration with our public health colleagues to ensure that we can go as upstream as possible and as downward in age as possible, as was pointed out by Councillor earlier, to support the early years and to prevent people becoming unwell in the first place. We have also established, in parallel to this, a group to look at the development of an outcomes framework. Now, the outcomes framework we want to be quite unique to Cornwall and the Isles of Scilly. I think we're slightly ahead of, we are ahead of the curve on this. There aren't that many other parts of the country trying to do this, but we want a common outcomes framework which enables us to gather feedback from those who use services on their experience, to gather feedback on the outcomes that people are hopefully experiencing, and a reminder of what those key outcomes are, that people feel listened to and understood, that they receive care and support at the right time within the right place, that they know what support's available to them, that they know that services are working together to wrap around them and their families, that people enjoy healthier lives and more hopeful lives, and that people receive support which is meaningful and valuable to them. The as-is situation is that across commissioned provider landscapes, we see people gathering lots of different information via lots of different tools. For example, clinical rating tools, some qualitative or quali tools as they're called, some are also known as PROMs and PREMs, patient-reported outcome measures, patient-reported experience measures. We want to establish a degree of consistency within a framework which people feel able to complete, information people feel able to gather, and information that people, our population, feel willing to share when they've experienced services. So we're developing that with some support with Exeter University. So we've done a literary review already to establish a very basic set of measures which are easily taken up by small providers across all sectors. Some of our smaller providers, some of whom are delivering some great innovation schemes within the suicide prevention programme, targeting smaller groups across our communities, fishing and farming communities, men's groups, also increasing support via the use of the arts to engage even more people. Often aren't data rich. They often don't have the means and infrastructure to gather the information to supply us with what we're looking for, which is the return on investment and the value. We're getting to a place where we will have an established outcomes framework which people can report into. It will be brief in form, but powerful in terms of how we can measure and analyse our success or otherwise. That will also inform planning as we move forward into years 2, 3, 4, and eventually year 5. And we will be finalising that by July this year. The implementation plan itself, we hope to finish by April the 1st of this year. As I said, there's been a slight delay, but I think that's it's fair to say we have been battling on many fronts for all the right reasons at the moment. And at the bottom of the paper we've provided is an embedded, excuse the alarm system, I'm looking forward here, that should go off in a moment. Noise, isn't it? Apologies, Chair. It should be...
You don't need to evacuate, Tim.
No, it's intermittent. No, I've just done my fire training, so I know that I shouldn't be worried at this point, and I don't worry. So, thank you. Apologies, Chair. So there is an embedded PowerPoint presentation at the bottom, which actually sets out the deliverables in relation to the COVID response and recovery cell, which I co-chair with a colleague, Dr. Richard Sharp, from Public Health, previously with Goldstein. And that, again, sets out another range of key deliverables to people with a range of conditions for the purposes of maintaining pathways, commission pathways, the access points, ensuring that we're supporting the population in terms of wellbeing support, and also supporting the workforce. So I'm happy to take questions and query, Chair, on that one. It's very much an update, and I'm looking here maybe for a bit of acknowledgement that we're on the right tracks. Happy to take queries and some pointers too, with a view to coming back with the final product in a couple of months' time. Thank you.
Thank you, Tim. I was worried our recording might go viral then if your office had started to burn down while you kept talking from that. Rachel, you've got your hand up.
Thank you, Chair. I just wanted to congratulate Tim and team in the sort of both the progression of the strategy with a clear timeline, which provides a really strong framework for also the health and wellbeing strategy, our joint strategy, because of course part of that is around mental wellbeing for both children and adults. And Tim's sort of work fits within that framework and ambition of the future, but also with the extensive work that has been stood up in response to COVID and the lockdown, which is described in those slides, and the work that has been done that's been timely. It's been thoughtful, it's been sort of evidence-based, and I really want to sort of commend the work to the board, particularly, of course, sort of in respect to some more of the Cornwall population, but of course, having the Isles of Scilly in mind as well. So I just wanted to say that, and clearly, this is something that's going to be an absolute priority in recovery from pandemic. For as you'll be aware, the impacts of this, but also on all age groups, on different cohorts, increasing potential inequalities, but also the drivers of poor mental health are all going to be the things that we're struggling with in terms of employment, sort of stress in terms of debt, all of those things exacerbating people's health and mental well-being, and also people who already have existing, conditions. They've really been hit hard. So I think I was just, wanting to share my concern with the board about the sort of future risks to mental well-being, but also recognise that we've got a good team that works really collaboratively and provides, I think, a really good example of joint working and progressing important work in really good timescales when needed. So thank you, Tim.
Thank you.
Thank you. Yes, I totally share the view. You put it far more articulately and concisely than I could have done. But obviously, coming out of lockdown is one thing. It's not the end. It's just the beginning for some, isn't it? Councillor Smith, your hand is up.
Yeah, I think Ashley might have been first. Whichever order you prefer.
I don't mind. I just think if I just could quickly do a quick bit of commending as well to Tim and Rachel for both of those strategies that you put in place, and the fact that they do marry up. That's no mean feat. I just also want to say, it's a bit like with the white paper, that when you do approve this mental health strategy, please be reassured that before we got to this point, Tim and I have been working together on the model for Scilly, and the model for Scilly was actually absolutely based on these principles. So Tim helped me with that commissioning model, and we respect it. So it was absolutely all about those key themes about prevention, easy access, on-island provision, etc. So again, we're a little bit ahead of the curve. And I think what's useful now is that for those who do need to go into more secondary settings, that there's a really clear and humane set of principles about how that's going to be supported.
Sorry. Go, Joel.
Oh,
yeah, thanks. Again, all sounds very positive. Sort of picking up on Rachel's point, I just wonder whether there's any evidence of how mental health in the population locally has changed during the pandemic. Have you got any sort of figures on that, or even anecdotal evidence?
I'm happy to come in addition to Rachel. Rachel, if you wanted to say something, or do you want me to respond?
There was a question to either Rachel or you, Tim, really. Yeah.
Well, Councillor Smith, yes, we do. We established a surge task and finish group to better understand the needs of the population in the first lockdown. We were very proactive in that. We've been managing at the oversight at a service level a range of activity measures. So how many people are being referred in and for what? We've also worked with our partners across Healthwatch to survey on 2 occasions the population, and we've had thousands of returns. It's been fantastic. And we are seeing an emerging theme. It's two-pronged. So firstly, we are not seeing over and above normal activity across service lines. Most service lines, if not all, are functioning at normal demand levels at the moment. However, we are seeing an increase in people who are coming in acutely unwell, and we're trying to get to the bottom of why that is. So acuity has increased, and that fits with a national picture. Generally, for those who are known to services, thankfully, have personalised care plans in place and crisis management plans. And our providers are all cognizant of what they need to do about that, and we're working together. Secondly, we're seeing a range of needs in terms of people's anxiety. People worried about the future. Economic worries are a key theme, and we're working with our partners across the other system cells to see if we can mitigate some of that and put in preventative measures. And the third and voluntary sector have been pivotal in helping us reach out as far as we possibly can to people who otherwise wouldn't step forward into services. They might not see themselves as having a mental illness as such or mental health need. We're trying to send a very clear message out. This is about well-being, and it's okay to have a conversation about well-being, and services will respond. So at the moment, we keep a watching brief on that. We have fortnightly meetings to look at the data, and we're linking up with our HEU colleagues who are doing, I think it's a national piece of work. I think we've got a workshop in a couple of weeks' time looking at exactly that, and HSEI are supporting us with that. So that's the local picture. Rachel, I'm sure there might be something else you wanted to add, but does that sum it up?
Yeah, thank you. I think, Tim, you've covered a lot of the detail there, but, in terms of sort of surveillance, Public Health England are doing quite a lot of sort of more regular surveillance of the whole population and feeding back on some key measures of mental health and wellbeing, and as Tim said, sort of anxiety being, very particularly on the rise, and depression. So there's some insights from that which aren't just describing our population, but which is where we get more local surveys from both things like the Healthwatch that you would have participated in as well, and also types of resident surveys, or in the case of actually sort of speaking to people who use as a service. So there's definitely a lot of indications, but I think that the demand for services has shown a different pattern, which is what Tim said. So you're looking to that potential surge for services, but obviously we're concerned about that whole population. And if you just think of each of us personally, how we may have been affected, and if we don't have resilience in a lot of different ways to cope with the changes and pressures that we've been in, or the financial and other opportunities to deal with pressures, it's a very personal and population-based sort of time multiplier effect, I guess is what I'm saying. So I think
No, thank you. And it sounds to me like there's potentially 2 problems. One is that you could be facing an awful lot of people coming to your services in the coming months and maybe years, but also that actually people don't come, and then there's a lot of mental health under the surface is just not being dealt with or talked about enough in the community and with friends and family.
I think that's right, and I think that's the national view. Some of this is unseen and unexperienced at the moment, so we're planning the mitigation now. So we are expanding services, we're expanding our talking therapy services, we're expanding support into primary care and across the PCNs to help mitigate this. The IAP services, improving access to psychological therapy services, will be expanding to meet the plan's trajectories, but with some additional support in terms of online support for those that can't access it. So we're trying our best to mitigate, to be as proactive as possible. The detail of which we can share, we're happy to share that with you, but that sits below the information I've shared today.
Thank you, Tim. It seems to me, Chair, I was just going to say there's maybe a lot of conversation that we can all have in the community about mental health to further this, Chair. Thank you.
Councillor Francis. Thank you very much, Chair. No, I would just like to commend the efforts being made. Thank you. And obviously with COVID, it's been somewhat reactive, having come in and hit everybody very quickly, without us knowing it was coming, as it were. But I'm very heartened by the focus that you're putting on prevention, and obviously the future will depend on that, and I think that's really, really, really important focus. So thank you for highlighting that, and I'm sure that will be the answer to mental health issues in the future if we're able to tackle that well, so that people actually aren't pushed into these difficulties. So thank you very much.
Thank you. And then just to very quickly respond to that, additionally, just to give further assurance that we are viewing the whole person as equally as important as the mental health component. So when it comes to health inequalities, the physical outcomes for those with chronic and enduring mental health conditions and a learning disability are certainly not as good as the general population, and we have a range of mitigations and plans in place to meet those too. I'm happy to present on those next time. Thank you.
Thank you.
Thank you. There were just three quick points I just wanted to raise to sum up, and one was around pathways. And are you happy about arrangements for children, young people's transition into your services and the way those sorts of links are going? The other one was about resource, and do you have enough? Again, touching on what Councillor Smith said, we could be talking about a surge in months and years. And finally, was about awareness as well. The whole point about the more we talk about it, the more people hear about it and read about it, particularly on Scilly and the services which are available, perhaps the more confident they will be to come forward.
Absolutely, Chair. Yes. So in terms of the pathways, there is a focused piece of work which sits within local planning as well as is mandated by the NHS long-term plan to look at transitions. The transitions, I think, could always be enhanced and improved upon, absolutely, particularly the groups we're most concerned about are those between the ages of 14 and 25. So rather than just focusing on the 16 to 18 transitions, we're thinking 14 to 25, and that's sort of borne out in the plans. So yes, that work's underway. In terms of resource, if we're talking about financial resource, we are within the planning round for next year and the year beyond. And I know that there is a broad set of principal commitments to mental health. How that will be borne out in terms of what goes in at this stage will be debated. We have to stratify all of our priorities against available resource, but there is a commitment to supporting mental health transformation, as is really our commitment to the long-term plan. It's a must-do. And thirdly, awareness. Yes, messaging. We are repeatedly promoting the things that we have been doing with our partners and stakeholders, both online and more tangibly through a media campaign which includes posters, flyers, and a number of other things that we're sending out across communities. Interestingly, we've just it might seem a small thing, but quite significant. We've just produced a whole load of pull-up banners and posters for our vaccination centres to remind people that there is mental wellbeing support out there and available to them. Messaging is really, really important. We do have a strategy in place for that, and we work that one out with public health. So thanks again to public health for pushing that one on. So that's great. Thank you.
Thanks very much. I can't see any more hands up. So we have a recommendation in your paper, Tim, that we acknowledge progress and comment accordingly. So I think we've done that. And again, pass on our thanks to you and your colleagues and your team for all you're doing.
Will do. Thank you, Chair. Thank you, members.
Thank you. I think that concludes the formal reports which have been tabled today. So I think it's just left for me to thank everybody for the work they're doing to support our community's health and well-being, and look forward to having another meeting in due course. So thanks for everybody who's given up their time this morning. Thank you.
Bye. Thank you.
Thank you.